Welcome back. It's time for our health updates. Joining us now is Africa 54 health correspondent Linord Moudou with a look at teens, sex, and HIV.
Hello, Vincent. Hello, everyone. Medical experts say African parents must talk to their teenage children about sex to avert new HIV-AIDS crisis on the continent. More than 2 million adolescents worldwide are living with HIV, and a whopping 80% of them live in Africa. Many are not aware they have HIV because they were infected at birth or through breastfeeding. This is Jane. She lives in Kenya's capital, Nairobi. Jane is 16 years old and is HIV positive. Because of the stigma associated with the disease, she did not wish to be identified.
I started falling sick often, so I decided to go to the hospital. That's when I found out I was pregnant. They did the HIV test and I discovered I was HIV positive.
Experts say HIV-AIDS is the main cause of death among 10 to 19-year-olds in Africa. They say the HIV-AIDS epidemic in Africa will explode again unless parents and teachers start talking to teenagers about sex. There are over 100,000 new HIV infections in Kenya each year, 21% of which are among girls and women aged between 15 and 24. Jane lives in Korogocho, a densely populated low-income area in Nairobi. She was orphaned at the age of 6.
I had a lot of boyfriends because I was just looking for a way to survive in order to get some money to provide for myself and my small sisters too.
Local NGOs and community organizations are trying to help. The Kenyan charity Liverpool Voluntary Counseling and Testing Center provides HIV/AIDS and sexual health services and education to teenagers.
About secondary abstinence, we talk about issues of STIs, prevention, the issues of drugs and alcohol. We talk about how to prevent early or teenage pregnancy. And in case one of them have ever had that or has a baby, how are they able to live safely and prevent infection of HIV in the future?
Kenya's HIV prevalence rate has fallen from 13.5% in 1999 to 5.6% today. Observers say the fight against AIDS is making progress globally. However, current policies are failing to save the lives of teenagers. Jane says it is hard to stay optimistic.
I have no hope, no expectations for my future. All I want to do now is take care of my daughter because I don't know when I am going to die. I am just waiting for my death.
The United Nations believes it can end the global threat of AIDS by 2030 with a push to scale up testing and treatment by 2020. As teenagers are vulnerable to getting infected with HIV/AIDS, perinatally infected children are confronted with many challenges as they transition to adolescence and adulthood. Joining us in the studio for more on the subject is Dr. Stephen Lee, Vice President of Program Implementation and Country Management with the Elizabeth Glaser Pediatric AIDS Foundation, EGPAF. Dr. Lee, welcome to the show.
Thank you. Thank you for having me.
Before we talk specifically about teenagers and HIV/AIDS, let's look at the big picture. EGPAF has been fighting pediatric AIDS for many years. There have been some progress. What would you say are some of the one or two key progress that you can mention and some of the remaining challenges?
Yeah, that's a great question. So the Elizabeth Glaser Pediatric AIDS Foundation has been engaged in the fight against HIV and pediatric HIV for many years. We're in 14 countries, have tested and engaged with over 20 million women over the years. I think the key component to preventing pediatric HIV and adolescent HIV is really getting women tested during pregnancy so they know their HIV status. And if they are HIV positive, is getting them on treatment to prevent transmission of HIV to their babies. And similarly, once a child is identified as being exposed, is making sure that we test the child so that we know he or she may know their status and be put on treatment if positive. So some of the advances that's actually already taken place is we know how to prevent transmission of mother to child, transmission of HIV.
So less children are born with HIV/AIDS. But as we look at the issue of teenage teenagers with HIV/AIDS. We saw in the report that the young woman was infected as a teenager. But these children that are born with HIV/AIDS are confronted with challenges when they transition to the teenage years. Can you tell us about your observation in terms of how this is being addressed? It seems like there's not enough emphasis on this.
Yeah, you know, just this week on February 17th, the UN/AIDS launched a new initiative called All in One. And this initiative is to address the issues in adolescents' HIV. The goal of this initiative is to really focus on in the areas where we need to make progress. And for specifically thinking about engaging adolescents in the fight against HIV. How do we use their experience, their knowledge, what they've experienced in developing programs and strategies that are targeting adolescents? It also focuses on getting more information and data to inform programming. And it also focuses on really mobilizing additional resources so that any adolescent who's at risk for HIV or has HIV would be able to know their status.
So practically, when we look at the teenage years, they're thinking, girls and boys are thinking about having a boyfriend, a girlfriend, hanging out, having fun. So how do we ensure that they are not victimized again when they want to get to that step where they feel like they are ready to start a relationship?
Yeah, I think engaging with adolescents on multiple levels is going to be important in a multifaceted approach. So it's focusing on adolescent-friendly sexual and reproductive health programs. It's focusing on community-based testing and treatment and support group programs that are very specific or focused on adolescents. It's ensuring that there are socioeconomic and educational opportunities for these young people who are infected. And then most importantly, as UN/AIDS is pushing for, is really engaging young people as mentors, as peer educators. And young adolescents who are experiencing HIV are probably the best source of support for other adolescents who are HIV infected.
Quickly then, how do we address stigma quickly?
The best way to address stigma, in my opinion, is to know your status and to know your HIV status and to be provided with the support for understanding what your status means and understanding how to disclose your status to your friends, to your partners, to colleagues.
Dr. Lee, thank you so much for joining us.
Thank you for having me.
And that was Dr. Stephen Lee. He is Vice President of Program Implementation and Country Management with the Elizabeth Glaser Pediatric AIDS Foundation. And that's our Africa 54 Health Report for today. Back to you, Vincent.
Well, thanks. And be sure to watch Moudou's health reports every Tuesday and Thursday right here on Africa 54. Well,